All right, so let's dive into something pretty fascinating here. The world of AI in healthcare in 2025. We've got this brand new white paper from the World Economic Forum and Boston Consulting Group. And it's painting a picture of a future where AI is basically changing everything. But that's really interesting is that despite all the hype, healthcare seems to be lagging behind other industries in actually implementing AI.
That's what makes this deep dive so interesting.
Yeah.
You'd think healthcare, with its reliance on data and technology, would be at the forefront of AI adoption. But the reality is, it's actually below the global average when it comes to AI maturity.
Yeah, that's a head scratcher, right? What's holding healthcare back? I mean, we're talking about an industry that's constantly dealing with huge amounts of data, complex processes, and a need for more personalized care. It just seems like AI would be the perfect solution.
You'd think so. But the white paper points to some interesting barriers. One of the biggest is that policymakers and healthcare leaders often struggle to grasp the immediate value of AI in healthcare. They're overwhelmed by the rapid pace of development and grapple with understanding its long-term impact.
So it's like they can't see the forest for the trees. They're so focused on the technical details that they miss the big picture of how AI could revolutionize healthcare delivery.
Precisely. And even when leaders do attempt to implement AI, the technical choices they make often don't align with their strategic health goals. It's like buying a high-powered sports car when what you really need is a reliable minivan to transport a large family. The tool needs to match the job.
Okay, so there's a disconnect between the potential of AI and the reality of implementation. But it's not just about complexity, right? There's also the issue of public distrust.
Absolutely. People have legitimate concerns about AI bias, data privacy, and the potential for these technologies to be used unethically. And when you're dealing with something as sensitive as health data, trust is paramount.
Yeah, the white paper also mentions that fragmented regulations and the lack of clear ethical guidelines create a bumpy road for AI implementation. So we've got this exciting frontier, but we're also facing some serious roadblocks. How do we balance the potential of AI with these very real concerns?
That's the key question. The white paper actually lays out 4 compelling visions for AI-enabled healthcare in 2025, and they offer a glimpse into what's possible if we can navigate these challenges successfully. These visions are transformation and well-being, 8 billion doctors, AI-powered operational excellence, and health leapfrog.
Okay, let's unpack these visions. First up, transformation and well-being. What does that even mean? Is it about using AI to prevent us from getting sick in the first place?
That's the core idea. Imagine a world where AI and sensors work together to monitor your health in real time, predict potential risks, and provide personalized recommendations to keep you healthy. Think personalized health plans, proactive lifestyle management, and early detection of potential issues.
So instead of waiting until something goes wrong, we're empowered to take control of our own health. That's a huge shift, isn't it?
It is. It's about moving from a reactive approach to a proactive one,
Yeah.
from treatment to prevention. The focus becomes maintaining well-being rather than just addressing illness.
Okay, that's pretty compelling. What about this 8 billion doctors vision? Are we talking about AI actually replacing doctors?
Not exactly. It's more about using AI to democratize access to healthcare information and expertise. Imagine having your own personalized AI assistant, available 24/7, to answer your health questions, provide guidance, and help you navigate the often complex healthcare system.
So it's like having a digital guide to better health, especially for those who might have limited access to traditional healthcare.
Precisely. It's about breaking down those barriers to access and empowering individuals to make informed decisions about their health.
All right, on to vision number 3, AI-powered operational excellence. This one sounds more focused on the behind-the-scenes aspects of healthcare.
Exactly. It's about using AI to streamline administrative tasks, optimize resource allocation, and basically make healthcare systems run more efficiently. Imagine AI taking care of scheduling, paperwork, and other administrative burdens, freeing up healthcare professionals to focus on what they do best, patient care.
So shorter wait times, fewer administrative headaches, and more time for doctors to actually spend with their patients. Sign me up.
That's the goal. It's about using AI to improve efficiency, reduce costs, and ultimately enhance the quality of care.
Okay, last but not least, let's talk about health leapfrog. This one sounds particularly interesting.
It is. This vision is about using AI to empower developing countries, to make significant strides in healthcare, even with limited infrastructure. Think about regions where access to basic healthcare is a challenge. AI could potentially help bridge that gap, enabling these countries to leapfrog over traditional development stages.
So instead of playing catch-up, they could actually surge ahead using AI. That's incredible. But are these visions really achievable by 2025? It seems pretty ambitious.
That's where things get interesting. While these visions paint a compelling picture of the future, the experts interviewed for the white paper offer a more nuanced perspective.
So a dose of reality.
Right. While some experts expressed excitement about these possibilities, others highlighted the significant technological and structural hurdles we still need to overcome. For example, current AI models can sometimes hallucinate.
Hold on, hallucinate. Like see things that aren't actually there? How is that even possible?
It's a complex phenomenon, but essentially, even the most advanced AI models can sometimes generate outputs that are factually incorrect or completely fabricated. This is obviously a major concern when you're dealing with medical applications where accuracy is paramount.
Yeah, you can't have an AI diagnosing a patient with a condition that doesn't actually exist.
Huh.
So it seems like we're at this crossroads. We have this incredible potential with AI, but also some very real challenges to address.
That's a great way to put it, and those challenges are exactly what we'll explore in the next part of our deep dive.
All right, so we've explored these fascinating visions for the future of AI in healthcare, but we've also uncovered some pretty significant roadblocks. Where do we go from here? How do we actually make these dreams a reality while addressing those very real challenges?
Well, the white paper doesn't just leave us hanging with a bunch of lofty visions. It also outlines 6 key calls to action, practical steps we can take to move beyond the hype and deliver real impact.
Okay, I'm all ears. Let's dive into those calls to action. What's the first step?
The first call to action emphasizes a shift in focus. Instead of getting lost in those big futuristic dreams of what AI could do in 10 years, we need to start delivering tangible benefits today.
So less pie-in-the-sky thinking and more boots-on-the-ground action. I like it, but how do we even begin to bridge that gap?
A great starting point is focusing on AI applications that improve operational efficiency. Think about streamlining administrative tasks, optimizing resource allocation, automating those repetitive processes that bog down healthcare systems. Demonstrating value right now is crucial.
Makes sense. Show people how AI can make a real difference today, and you're more likely to get buy-in for those bigger, more ambitious projects down the road. It's like building trust, right?
Exactly. Early successes attract long-term investment, and they also help build that crucial public trust we were talking about earlier. People need to see AI working effectively and ethically before they're willing to embrace its full potential.
Okay, so focusing on tangible benefits is the first call to action. What's next on the list?
The second call to action highlights the importance of collaboration. We need to move away from the private sector developing technology in isolation and embrace a more collaborative approach between the public and private sectors.
You know, I was going to ask about that. Why is that public-private partnership so crucial in the context of AI and healthcare?
Because AI and healthcare isn't just a technological challenge, it's a societal one. We need to align the goals of both the public and private sectors to ensure that AI is being developed and implemented ethically responsibly and for the benefit of everyone, not just a select few.
It's about using technology to create a better world, not just advancing technology for its own sake. I like that.
Exactly. And that requires a shared understanding of the challenges, the opportunities, and the potential risks. It's about working together to find solutions that benefit society as a whole.
Okay, on to call to action number 3. What's next on the agenda?
This one's a bit more technical, but equally important. It's all about investing in shared digital infrastructure, specifically digital public infrastructures or DPIs.
Okay, for those of us who aren't tech wizards, break that down for us. What are DPIs and why are they so important in this context?
Think of a DPI as a foundational layer of digital building blocks that everyone can access and build upon. Imagine a common set of digital tools and resources that can be used to develop and deploy AI solutions more efficiently and equitably.
So instead of every organization building its own separate system, they can leverage this shared infrastructure. I can see how that would save a lot of time, resources, and probably headaches.
Exactly. And not only does it promote efficiency, but it also levels the playing field, making AI accessible to smaller organizations and developing countries that might not have the resources to build these complex systems from scratch.
That's a crucial point. We need to make sure that AI benefits everyone, not just those with the most resources. It's about equitable access, right?
Absolutely. DPIs can play a vital role in making that vision a reality.
All right, call to action number 4. What's up next?
This one focuses on leadership, CEOs, Policymakers, healthcare leaders, they all need to level up their understanding of AI. They can't just delegate these crucial decisions to their tech teams and hope for the best.
So you're saying leaders need to become AI experts. I'm not sure I see every hospital CEO writing code anytime soon.
It's not about becoming programmers. It's about developing a deeper understanding of the core concepts of AI, its potential, its limitations, and its ethical implications. It's about being able to ask the right questions and make informed decisions.
That makes more sense. It's about empowering leaders to guide the implementation of AI in a way that aligns with their organization's goals and values.
Exactly. It's about moving from a place of fear or uncertainty to a place of knowledge and confidence when it comes to AI.
Okay, on to call to action number 5. What's this one all about?
Trust. We can't just sit back and wait for regulations to catch up. We need to be proactive in building public trust in AI, especially in a field as sensitive as healthcare.
That's a big one. There's so much fear and uncertainty surrounding AI, especially when it comes to something as personal as our health. How do we even begin to build that
It
trust?
starts with transparency. We need to be open about how AI is being developed and used in healthcare, clearly communicate both its benefits and risks, and establish robust ethical guidelines that prioritize patient well-being and data privacy.
No more black boxes, right? People need to understand how AI is being used and how it's making decisions that could potentially affect their health.
Exactly, and we need to ensure that humans remain firmly in the loop. AI should be a tool that empowers healthcare professionals, not replaces them.
That's reassuring to hear. I think a lot of people are worried about AI taking over healthcare completely. It's good to emphasize that it's about augmenting human expertise, not replacing it.
Precisely. It's about finding that synergy between human intelligence and artificial intelligence to deliver the best possible care.
Okay, we're on the last call to action. What's the final piece of the puzzle?
This one's all about data. We need to move away from those fragmented, siloed data sets that are scattered across different organizations and embrace a more integrated approach.
So instead of data being trapped in all these separate silos, we need to find ways to bring it together. But how do we do that while still addressing those concerns about data privacy?
That's where the concept of globally connected but locally controlled data sets comes in.
Right, we touched on that earlier. Remind us why that's so important.
It's about finding that balance between collaboration and control. We need to be able to share data to train more robust AI models, but that sharing needs to happen in a way that respects privacy and ensures that individuals and communities retain control over their own data.
So it's not an all or nothing situation. You can have collaboration without sacrificing privacy.
Exactly. It's about building systems that allow for secure, responsible data sharing while empowering individuals to make informed choices about how their data is used.
These 6 calls to action are really insightful. They paint a clear roadmap for navigating the complexities of AI in healthcare. But I have to ask, are we really ready for this? Are we prepared to embrace these changes and harness the full potential of AI for good?
That's the million-dollar question, isn't it? And it's one we'll explore further in the final part of our deep dive.
Okay, so we've unpacked these incredible visions for AI-enabled healthcare, and we've explored the practical steps we can take to move from aspiration to reality. But now for the big question, what does this all mean for the future of healthcare? Are we on the cusp of a true revolution, or are we getting ahead of ourselves?
Well, the future of AI in healthcare is being shaped right now, and it's a future filled with both immense possibilities and complex challenges. What we do today, the choices we make, the investments we prioritize, the ethical considerations we grapple with, all of these factors will determine whether AI truly transforms healthcare for the better, or whether it exacerbates existing inequalities.
So it's not just a foregone conclusion. We're not just passively riding the wave of technological advancement. We actually have agency in shaping how this all unfolds.
Absolutely. This isn't about simply accepting whatever technology comes our way. It's about making conscious, deliberate choices about how we want to integrate AI into healthcare, ensuring that it serves humanity, not the other way around.
That's a powerful thought. It puts the responsibility squarely on our shoulders. But it's also incredibly empowering to think that we have a say in shaping this future.
It is. Imagine a world where AI helps us live longer, healthier lives, where access to quality healthcare is a right, not a privilege, and where technology empowers both patients and healthcare professionals to make more informed decisions. That's the potential we're talking about.
Yeah, it's a future worth striving for, that's for sure. One thing that struck me throughout this deep dive is the emphasis on collaboration. The white paper really hammers home that point.
Yeah, it's crucial. We need strong public-private partnerships, open collaboration between researchers, policymakers, and healthcare providers, and perhaps most importantly, we need to listen to the voices of patients.
That's an interesting point. Why is it so important to bring patients into the conversation?
Because at the end of the day, healthcare is about people. It's about improving human health and well-being. We can't just develop and implement these technologies in a vacuum. We need to make sure that patients are involved in the process, that their concerns are addressed, and that their values are reflected in the way AI is integrated into healthcare.
Yeah, it can't just be a top-down approach. We need everyone at the table to ensure that AI is used ethically and effectively.
Exactly. We need diverse perspectives, open dialogue,
Yeah.
and a willingness to adapt and learn as this technology evolves. It's a continuous process of discovery and refinement.
This deep dive has been incredibly eye-opening. I feel like I have a much deeper understanding of the potential of AI in healthcare, the challenges we face, and the crucial decisions that lie ahead. But as you said, there's always more to learn.
That's the exciting part. We're just at the beginning of this AI journey, and the possibilities are truly limitless. It's up to us to navigate this new frontier with wisdom, foresight, and a commitment to using this technology for the greater good.
Well said. And as we wrap up our deep dive, I think it's important to leave our listeners with a question to ponder. How do we ensure that AI serves humanity? That it benefits everyone, not just a select few? It's time to move beyond the hype, beyond the fear, and start building a future where AI transforms healthcare for all. Thanks for joining us on this deep dive. It's been a fascinating journey.